In Kumasi, a delegation of health officials led by Director General of Ghana Health Service, Dr. Patrick Abuaje, is in the region capital to investigate why more COVID patients in the region are succumbing as against the situation in other parts of the country. The region accounts for 58 deaths, almost half of Ghana's death toll for COVID-19, which stands at 129 as of July 9, 2020. Regional Health Director Dr. Emmanuel Tinkran describes the fatality as highly unacceptable as he calls for concerted efforts to bring it down. This afternoon, that investigation is underway. We'll go live there now for details. First, though, Ohime Nteria of our health desk has this report.
Ashanti Region has seen COVID-19 deaths jump from 5 from May 10, 2020 to 58 as at yesterday, July 9, 2020. Confirmed COVID-19 cases leaped from 453 to 4,972 with 3,641 recoveries over the same period. Out of 42 districts with confirmed cases, Kumasi Metropolis tops the death toll with 33. Obuasi Municipality and Obuasi East District follow with 4 each. Efijakwabre South and Kwadaso have 3 apiece, with Otafo 2. 9 other districts have each lost 1 person. Health authorities say they are analyzing the worrying trend as there's evidence of many patients being brought in either dead or die less than 24 hours on admission. Dr. Emmanuel Tinkran is the Ashanti Regional Health Director.
I'm very much concerned. Sincerely, that has been my work. And every day we are working, we are analyzing records, because you realize that most of them come and die within 24 hours. Some of them even are brought in dead. And you do the verbal autopsy and say, oh, this may be COVID. So these are some of the challenges. So it means that most probably the awareness is not high, or the denial is still very high. And that's the reason why people are just ignoring the protocols and then the guidelines. The mortalities may be due to the fact that people are reporting late, or people are living in denial, or we are dealing with a difficult strain, or we are not managing the cases as expected. All these are factors. We are trying to analyze the data and then classify the deaths properly to see how they come in, how they die, the signs and symptoms, whether it's COVID death or COVID-related death. All these are something that I think we need to start researching into to find out why the mortality in the Ashanti region is quite high compared to all other regions in this country.
Despite ongoing public education, many residents in the region doubt the existence of the coronavirus. People continue to flout safety protocols such as social distancing, wearing of face masks and hand washing with impunity. The likely consequence is that a few will report COVID-19 related symptoms at health facilities. Dr. Tinkran attributes the cause of the trend to several factors, but he singles out public apathy to the virus.
It seems that people are not serious about it. And so even when they are sick, they just won't come to the hospital. They stay till they are just about to die. So in fact, we need a lot of, not only the health system, but we need a concerted effort by all the stakeholders, everybody, so as to maybe embark on continuous education for the people in my region to realize that we have a challenge. We shouldn't just sit down thinking that nothing is happening. And sometimes I go around, I interview people, and they think that there's nothing. You are just, you are just scaring us. You're scaring us. There's nothing. You say there's a problem, but we don't see any problem. It's because they are not in our hospitals. And sometimes what they tell us is so hurting.
From Kumasi, for JoyNews, Ohime Nteria reporting.
We're trying to get my colleague Ohime Nteria, who will join us with some details about this ongoing investigation to tell why there's a high mortality rate in the Ashanti region. Health experts are currently investigating the matter, led by Ghana Health Service Director Dr. Abuaje, and to tell us why the region is recording those deaths. Ohime Nteria, if you can hear me, what more can you say about this? We'll try and get on him interior on this bit. But on the 16th of June, the Ghana Medical Association warned Ashanti Region COVID-19 mortalities could increase if the government does not set up a dedicated facility to receive COVID-19 positive patients. Regional President of the Ghana Medical Association, Dr. Parkway Sibedo, revealed Komfanochi Teaching Hospital is now receiving COVID-19 positive patients on the wards, a situation he says is increasing the risk of infections. He also hinted more doctors at the hospital are getting infected due to lack of personal protective equipment. We'll bring you a playback of that story by Erasta Sasaridonko.
The situation here is dire at the moment, and the Accident and Emergency Center, which you see behind me, is the source of referral for many hospitals across the region and even beyond. So we have emergency cases coming here all the time.
The situation is really bad. If you look at the statistics from the Ghana Health Service, you realize most of the deaths are from here. And if you get to our hospital, you realize if you pass through the accident and emergency unit, you realize that they are expanding the holding area. Now, you go, previously we used to have the holding area, and then those who come back confirmed are subsequently transferred to the HIU, as we call it, at the other side of the hospital. But now there is a spillover. You get it, patients who have tested positive are being kept at the main hospital, at the emergency on the wards, and that is the situation. In addition, you realize that aside the system being under so much pressure, we have most of our colleagues getting infected. And I'm saying this because we of the Ghana Medical Association are collating the data on number of doctors who have gotten infected in the line of duty. And so we know the actual numbers. And I am saying this on authority that so many of our patients, of our colleagues, not doctors alone, but nurses and other staff are getting the infection.
Put a figure to it. How many are we talking about?
Yeah, on the last count, as I said, we're still gathering the data. On the national level, we have close to 80 doctors. We're collating the number of doctors who have it. I'm sure in the course of the week or next week, we'll get you the actual analysis of the doctors. But here, per my last count, it will be close to 15-20 of our colleagues in this hospital. And as I said, we're collating the data on them, and that's how come I know the actual numbers.
The spillover of patients. How do you mean when you say that?
You know, previously for every institution, we have holding areas, and then we have the treatment. When you come to Komfanochi, we used to have a holding area, which is a place they designated under the disaster building. I'm sure if you pass there, you see it. And then once your results comes and you are moved to Poly, we have the highly infectious units where they treat. You have everything set up. But then the holding areas are full. And as we're talking now, we have patients who are kept at the accident and emergency unit. These are actual patients who have confirmed, the test confirms COVID. So you go to the accident and emergency unit. That's the situation now. And
what is the danger in that?
You know, I don't want to overemphasize this, but you realize that we know the mode of transmission, and we know because it's highly. That's why we have isolation centers. But then if you are keeping those who have already tested positive in a ward containing other patients who have other conditions, one, there's the risk of transmission, because you see, all the staff entering, right, if the positive patient is confirmed positive and they are moved there, whoever is entering that unit should be fully protected. But as we have it now, you have designated places where we are keeping them. But then everybody there should be in the full PPE. But that's not what is happening. We have visiting times where you enter and you realize people are coming to visit their relatives. They enter the place, they don't have the full protective gear. Doctors, nurses, pharmacists, orderlies enter the place. They are not in full protective gear. So the risk of transmission from those infected with the COVID to the staff is high. And I'm not surprised. As I said,
my colleague Ohime Teria now joins us with some details about the deaths in the Ashanti region. Ohime, what is the current situation and what's being done now by the authorities to bring the situation under control?
Thank you, Aisha. According to the Regional Health Directorate, 58 COVID-19 related deaths have been recorded in the region. 58 COVID-19 related deaths have been recorded in the region. If you look at the distribution, you realize that the Kumasi metropolis alone is contributing 33 of the deaths as far as COVID-19 is concerned. And out of the 33 districts like Obuasi Municipality and Obuasi East, they have recorded 4 each, with the Jaffa South and Fada also recording 3 each. We have Otafo with 2, and 9 other districts have also recorded each death. And so that is the situation as we speak in the Ashanti region.
Tell us about the visit of the Director General of the Ghana Health Service. What have they gathered so far?
Unfortunately, I am not privy to the visit of the Director General of the Ghana Health Service. But what I do know is that today a stakeholder consultative meeting was held where stakeholders in the region were invited, police, those in the security agencies, including police, were invited. The Muslim community as well as the Christian communities were all invited to come and assist the Regional Health Directorate, share ideas on how best the COVID-19 figures in the Ashanti region could be controlled. As we speak, as of today, the Ashanti region has recorded 5,150 COVID-19 positive cases, 5,150 COVID-19 positive cases and 58 deaths. Recovery stands at 4,138. And then active case as of now is 954. As at the time we had the meeting, the stakeholders, especially the clergy, were not happy that over the period they have been neglected as far as the COVID-19 fight is concerned. So now the plan is that all the stakeholders will come together to support the efforts of the Ghana Health Service to reach out to the Ashanti region, especially where there's this belief that people are still living in doubt of the existence of COVID-19. That has been the challenge of the Regional Health Directorate as far as public education is concerned in the Ashanti region. There are instances, especially when I spoke to Dr. Tinkran, he mentioned that you go to some point, you speak to people as to why they are not in their face mask, and you want to encourage them to put on the face mask. And the indication or the message you get from them is that there's no problem. You are trying as a health expert to create a problem for people. So this, he says, are some of the disheartening moments for public health experts in the region. But that notwithstanding, he says they want to move forward to reach out to more people to propagate the message of COVID-19, saying that COVID-19 is real. So it's time for people to adhere to all the safety protocols of social distancing, and then wearing of face mask, and also ensuring that you wash your hands at all times. As part of the measures, they are introducing a lot of measures, I must say. One of it is to ensure that the Regional Health Directorate will lead a crusade to distribute as much as 15 million face masks to the residents. We estimate the Ashanti region of population of about 5 million. So, the Regional Health Directorate is targeting 3 face masks to each resident. So they are targeting 15 million face masks to be distributed to residents of Ashanti region. They told me, yes, they've received the blessing of the Asante the overlord of the Ashanti Kingdom, and they believe that with his support, they will be able to reach out to organizations and individuals to support the crusade against COVID-19. He says if there's any moment, any time to reach out to people as far as COVID-19 is concerned, then the time is now. And this is a part of the measures that the Regional Health Directorate is instituting to reach out to people. Now, at the stakeholder consultative meeting, the widely acceptance is that all of them are going to work in tandem. The non-governmental organizations promise their support. Police also promise their support. Just that police expressed the fact that when they started, the RESET started introducing this custodial sentence of allowing people to clean the streets when you are not, for instance, in your face mask. The human rights campaigners started, lambasting police left, right, center, and this is something they say demoralized them. But if you look at the EI 164, the measure that the government has introduced, the fact that anybody who goes contrary to the executive instrument, it means that either you pay between 12,000 Ghana cedis and 60,000 Ghana cedis. This is something that they believe is too outrageous. So if something can be done about this particular law, then it will go a long way to also compel people to accept and also adhere to the safety protocols as being announced by the Ghana Health Service.
Ohiming, but generally, what can you report of the people's general respect for the safety protocols as far as COVID-19 is concerned?
It's a major concern not only for the health experts or the health directorate. Some of us, when you walk in town and you see how people are flouting these safety protocols, especially at the market centers, there's a particular spot called Roman Hill area. When you go there, you see a lot of traders, crowded in particular area, majority of them not in face mask. And that is a concern to everybody in the region. But the unfortunate thing is that when you speak to some of these people, the impression they try to create is that you are the ones, trying to put some fear of God in them. For them, they have no idea of COVID-19. Indeed, if COVID-19 do exist, how come they are not seeing people, dying on the streets as compared to what happened in somewhere in China? And so that has been the mindset of the people. A lot of people, though there has been this campaign that people should put on their face masks, many of them are not in face masks. And then let me also touch on the healthcare workers, the case scenario for healthcare workers. In the Ashanti region, as of now, the Regional Health Directorate, as of today, has recorded 230 COVID-19 positive cases among the health workers. And out of the 230, one death has been recorded with 219 recoveries. So as of now, the active cases stands at 11.
Ohiming Teria is with our health desk, and he's been giving us some updates on the Ashanti region, which is recording more deaths, almost half of what the nation has.